Bipolar disorder by Audrey and Thomas. What is bipolar disorder? A mood disorder, chronic or episodic, where a person alternates between extreme and fluctuating mood changes, hopelessness of depression, and the overexcited and unreasonably optimistic state of mania. It's basically extreme highs followed by extreme lows and is a vicious cycle. Diagnostic criteria: mania. It is a distinct period of abnormal behavior, extremely elevated and unreasonable goal setting. Lasts at least 1 week to nearly every day, and needs 3 or more symptoms present at a time to be diagnosed. Some symptoms include inflated self-esteem, decreased need for sleep, flight of ideas and thoughts, like basically racing, distractibility, you're drawn to irrelevant and unimportant stimuli very easily, increasing goal set activity, basically like socially, school, work, even sexually. You have a lot of goals set that makes you want to do lots of more activity than you normally do. Excess in involvement in activities with high risk of danger or painful consequences, like drug deals or stuff like that. Here's a diagnostic criteria for depression. Distinct period of an extreme low following a manic episode because it's like a cycle. You need 5 or more symptoms present during same 2-week period or longer. Some symptoms for depression include depressed mood or loss of interest and pleasure in stuff that you're normally interested in. Depressed mood most of the day, nearly every day. You're feeling sad, empty, hopelessness, irritable mood. Irritable mood is more common in adolescents, but it can be in adults too. Loss of interest in most things they normally love. Significant weight loss without diet or even weight gain too. Insomnia almost every night, which is where you have a lot of trouble falling asleep at night. Comorbidity. So these are just some other things you can acquire while having bipolar disorder. You can get anxiety disorders like panic attacks, social anxiety, ADHD, any disruptive impulsive control, substance abuse, common with alcohol and drug abuse, eating disorders, more common in females, severe depression, higher rates of serious medical conditions, and 15 times higher risk of being suicidal or committing suicide. Prevalence, which is commonness. It's more common in the United States than other countries. About more than 4% of the U.S. population has bipolar disorder compared to a worldwide average of 2%. And here's just a slide of the lifetime prevalence rate for bipolar disorder with some countries around the world. And as you can see, the United States has the highest percentage with about more than 4%.
Groups affected. It often develops in ages 15 to 19 and rarely after 40. People with a certain set of genes are more likely to develop bipolar disorder. And people with a parent or sibling who's affected by bipolar disorder have an increased chance of developing it. People with the disorder may have a different brain structure than people without bipolar disorder.
Some primary causes are the environment, like growing up, how your life was growing up, family life, how you were treated, stress, which is a major factor to primary causes, events going on around the world, which can also cause stress, biological traits, hereditary components, mix of family genes, history. And what's interesting is many people think genes are the primary cause of bipolar disorder, but that's not necessarily completely true. Even though it does play a role, it's not as major as people think it to be. But the mix of genes and hereditary components do contribute a lot. Brain function, deficiency of serotonin and norepinephrine, which are neurotransmitters, and when they're unbalanced, they make you more depressed and more of a likely to have bipolar disorder, which is more of a bigger factor than genes. Risk factors, more common in high-income countries, family history, which is the strongest risk factor, mix of genes, brain structure, unbalance of neurotransmitters, like we talked in the last slide. Also, traumatic events and experiences, and people like abuse or sexual assault, all that kind of stuff. People who are divorced, separated, or widowed are more likely to have bipolar disorder than people who are married or have never been married. Also, twins. If one twin has bipolar disorder, if it's a fraternal twin, the other twin has a 50% chance of being bipolar, and an identical twin has a 70% chance of being bipolar. Also, females are more likely to have bipolar disorder than men, and they have more frequent vicious cycle changes during the disorder than men.
Some therapist treatment options are to prescribe you mood stabilizers, which help prevent mood episodes and reduce their severity. Incorrect dosages can lead to patient developing depression. Lithium, which is a mood stabilizer, is often prescribed. Incorrect dosages lead to diarrhea and getting sick. You must get kidneys and thyroid function checked every 3 months if dose is being adjusted, and blood test at least every 3 months to check lithium levels. Anticonvulsant medicines, which can be taken in combination with lithium, are also prescribed. Valproate, not prescribed to women in pregnancy for child safety, are one type of these medicines. Carbamazepine requires you to have a blood test to check on liver and kidney function at start and after 6 months. Weight and height are also monitored while using this. Lamotrigine has only one side effect, which is rash can develop, and this is also prescribed under anticonvulsant. You could also get prescribed antipsychotic medicine. Is used if symptoms are severe, and all antipsychotic medicine have the same side effect. Side effects including blurred vision, dry mouth, constipation, and weight gain. Some types of antipsychotic medicines are aripiprazole, olanzapine, quetiapine, risperidone. You could also get psychotherapy instead of taking medications, which aim to identify and change troubling emotions and thoughts and behaviors. And as another treatment is being physically active, like working out or doing sports a lot, to help treat bipolar. Prognosis of bipolar is, if you don't take medicine, the disorder can develop into other conditions like psychosis, anxiety disorder, ADHD, drug and alcohol addiction, and eating disorders such as bulimia and binge eating. This disorder lasts for life, and there is a chance of the disorder being misdiagnosed for another disorder instead of bipolar. For referral, you should talk to your doctor or healthcare provider, or you could visit the SAMHSA website, which has behavioral treatment services locator that can search for treatment information by address, city, or zip code. Or you can call their phone number as presented on the slide. You should seek immediate help from a doctor or the nearest hospital emergency room, or call 911 if you or someone you know is in crisis and considering suicide. A local healthcare provider, Sunrise Detox 2nd, which is on 1272 Long Hill Road, Sterling, New Jersey. You can call them at the following numbers on the slide.
I hope you are more informed on this topic. Thank you for listening. Please like and subscribe.
So how's your day going?
I don't want to be here.
Was your week bad?
I don't know. I just feel really tired and irritated all the time. I don't really feel like doing anything.
So how's the week before though?
I don't know, it was kind of weird. Last week I just felt like I wanted to do a lot. I was doing all my homework, going to all my activities. But this week I just really didn't want to do anything. I kind of just stayed in bed and didn't even do my homework. I don't know. It's like really weird.
That's interesting. Well, there are a few medications to help you with this. You're obviously suffering from bipolar disorder, and you could take some specific medicines like lithium.
That sounds horrible.
Yeah, lithium, it does have a side effect. If you take abnormal dosages, you could have diarrhea, you could have other things with it too. And you gotta get your blood tested too.
Sounds like a lot of work.
Alright, how about psychotherapy talk? You are talking with a therapist about your issues?
Kind of like right now.
Yeah, and the therapist will help you identify warnings and behaviors, like warnings in behaviors. Like, they'll show that like, this behavior is abnormal, it's not really...
Sounds pretty cool. Like, I do like to talk sometimes.
So you prefer that over any medication?
Is there any other medication that doesn't cause that?
Well, every medication, they have their own side effect. Like you also have anticonvulsants, but some of these, like, they cause rash, they cause some blood pressure issues and weight issues. Yeah.
I mean, whichever one will probably help balance myself out, I guess would be worth it.
Alright, I think you could also do both, but I think a therapist would help too, because you could also work out, and working out will help you control these emotions as well.
Sounds exciting.
So you could probably do like a therapist workout combo.
Sounds cool. Yeah. I think I'd be into that.
Alright, and if you need any more help, you could always go visit SAMHSA. You could visit them online, or you could talk to them on a phone number. I have a card.
Okay.
Yeah, they'll help you out, set you up really easy with a good therapist.
That's pretty cool. Sounds good.
Have a good day.
Thank you. I'll go call my mom.